So it's good to know what to expect when you go to see the fertility specialist. And what the fertility specialist is going to try to determine is what might be the cause of the infertility. One of the ways to do that, or to understand that, is to understand what the potential causes of infertility are. This can be broken down into male and female factor. Approximately 40% of infertility is due to male factor. That male factor can include things such as difficulty with ejaculation or abnormalities in the sperm count or in the semen. We can look for the count, the motility, and the shapes of the sperm, and if there are deficiencies, then we need to try to determine the etiology. Generally, we want to check an initial semen analysis, and if there is an abnormality, then a repeat semen analysis will be requested. If there are two abnormalities, then it will depend on the degree of the abnormalities as to whether or not we might suggest that the male see a urology specialist, one who is especially interested in determining male factor problems. Female factor infertility accounts for about 40% of infertility, and a combination of both male and female factors accounts for about 20%. For female factors, we are looking at ovulation and whether or not ovulation is occurring regularly. We are looking for potential problems such as fallopian tube issues and whether or not the fallopian tubes are open. We do have concern about a condition called endometriosis that might affect fertility. Also, scarring within the pelvis can cause a problem potentially with the fallopian tubes being able to function. In addition, we may be looking for factors that make it more difficult for the sperm and egg to meet. And we are also looking at the luteal phase and the progesterone level as to whether or not the endometrial lining, the lining where the baby would attach, is developing in a healthy manner. All of these tests, as well as hormonal tests, are part of the initial infertility evaluation.